If you had a gauze pad placed over the surgical area, it should be kept firmly in place for 45 to 60 minutes. Then the gauze pad should be removed carefully and replaced with new gauze if the site continues to bleed. The gauze is not actually intended for soaking up blood, although it will naturally do this, but rather biting on the gauze will help keep pressure on the surgical site, and pressure is what will help the bleeding to stop. Vigorous mouth rinsing or touching the wound area following surgery should be avoided. Rinsing might cause bleeding by allowing the blood clot that is formed to become dislodged. Take the over-the-counter pain relievers, or, if prescribed, prescription-strength pain medications as soon as you begin to feel discomfort. This usually coincides with the local anesthetic wearing off. Limit your activities the day of surgery, and only resume normal activity when you feel comfortable. If you were sedated, you should minimize activity for at least 24 hours. Do not spit, drink through a straw, or smoke. Place ice packs on the side of your face where surgery was performed to help minimize pain and swelling. Only apply ice for 15 to 20-minute periods for the first 24 to 36 hours. Do not lay flat. Place an extra pillow under your head or rest in a recliner. This helps minimize bleeding, swelling, and throbbing.
Bleeding after surgery is common, and it can be difficult to predict how long bleeding will continue in each individual. Keep in mind that it can be difficult to swallow immediately after the surgery, and a little bit of blood mixed with saliva can look like a lot of blood. The gauze pads that were placed over the extraction sites before leaving the office are for applying pressure, not necessarily for soaking up blood. Continue changing them every 20 to 30 minutes once you are home. You should notice that the bleeding is slowing down within 1 to 3 hours. If bleeding continues, a moistened tea bag placed over the site without movement for 45 to 60 minutes will help promote a blood clot. However, if you continue to have bleeding, please call our office for further instructions.
While you may feel swollen immediately after surgery, this usually is just a sensation caused by the anesthetic. The actual swelling typically shows up the day after surgery, and it may continue to increase for 2 or 3 days. The sides of the jaw, cheeks, and lower eyelids are common locations for swelling. The best way to minimize swelling is by keeping the head elevated with extra pillows, or by resting in a recliner, and then applying ice packs to the face. Refreezable cold packs, a bag of frozen peas, or crushed ice in a Ziploc bag, wrapped in a t-shirt or towel, should be applied firmly to the face in intervals of 20 minutes on and 20 minutes off, when possible, for the first 24 to 36 hours after surgery. Smoking can cause dry socket, a very painful condition that usually requires further in-office care.
Smoking negatively affects your body's natural ability to recuperate, and it significantly delays healing. It can also compromise the success of the implant surgery itself. It would be ideal to quit completely, but if you must smoke, please wait as long as possible, at least 4 to 5 days, before doing so. This includes all forms of smoking, even vaping and e-cigarettes.
Discomfort following surgical procedures is common, and this occurs as the numbing medication begins to wear off, typically within 2 to 3 hours after surgery. For moderate pain, over-the-counter acetaminophen, or Tylenol, or ibuprofen, like Advil or Motrin, can be taken as indicated on the product packaging, unless your doctor has instructed you not to. For more severe pain, take the prescription pain relievers your doctor has prescribed. To avoid nausea, do not take medications on an empty stomach. Never mix prescription pain medications and alcohol. Never take anyone else's prescription medication. Do not drive or operate machinery while taking prescription pain medications. You may begin taking fluids immediately after surgery, and water and juices are the best choices. Avoid coffee, tea, and other hot beverages on the day of surgery, and no straws for 4 to 5 days after surgery. As you are able to tolerate drinking, you may advance your diet to softer foods that do not require chewing. Things like applesauce, mashed potatoes, Soups, gelatin, and protein shakes are a good start. Your body needs proper nourishment to heal quickly, so make sure to take plenty of fluids as you slowly change your diet to more solid foods within a few days. Try not to miss a meal and make healthy choices.
Nausea and vomiting can sometimes occur as a result of the discomfort, anesthesia, or pain medication. Postoperative nausea is usually self-limiting, and sipping on flat cola or ginger ale often helps. If nausea persists, stop taking the pain medication and substitute an over-the-counter pain medication for the next dose. If nausea still persists, please call our office for further instructions.
Depending on the nature of the surgery performed and the individual, some discoloring of the face may be seen for 3 to 5 days after the surgery. The development of black, blue, green, or yellow discoloration is due to blood spreading beneath the tissues. This is a normal post-operative occurrence. If this happens, do not be alarmed. Moist heat applied to the area may help speed up the removal of the discoloration.
If you've been placed on antibiotics, take the tablets or liquid as directed. Antibiotics are given to help prevent infection, but you should discontinue the antibiotic use in the event of a rash or other unfavorable reaction. If this occurs, please notify our office why you've stopped taking the prescribed antibiotic, and, if needed, an alternative may be prescribed. Women, please note that antibiotics can interfere with the effectiveness of birth control medications.
Sutures will usually dissolve on their own within 1 week. If non-dissolvable sutures were used, you should have been scheduled for a suture removal appointment. If a suture comes loose before your removal appointment, there's no need for concern. Simply remove the suture from your mouth carefully and throw it away. On the morning following your surgery, rinse with warm salt water. Half a teaspoon of table salt mixed well into 1 8-ounce glass of warm water, and then rinse after every meal and before bedtime. You may rinse as often as you would like, but remember to wait until the day after surgery. You should begin to brush and floss your teeth as normal, but avoid the surgery sites for a few days. If you were given an irrigation syringe to rinse out sockets on the lower jaw, wait for 3 days before using it. If numbness of the lip, chin, or tongue occurs, there is no cause for alarm. As stated before surgery, this is usually a temporary sensation. Be aware that if your lip or tongue is numb, you could bite it and not feel it at all, so please be careful. Call our office if you have any questions or if you have numbness persisting the day following surgery. Slight elevation of temperature following surgery is not uncommon. If a high temperature persists, please notify the office. Acetaminophen or ibuprofen should be taken to reduce the fever. Be careful going from the lying down position to standing. You could get lightheaded if you stand up suddenly due to several factors. You were not able to eat or drink prior to surgery. It is difficult to take fluids, and taking pain medications can make you dizzy. As a safety precaution, sit upright for 1 minute before standing. Occasionally, patients may feel hard projections in the mouth with their tongue. They are not roots. They are the bony walls that used to support the tooth. These projections usually smooth out on their own, but if not, we can remove them. If the corners of your mouth are stretched, they may dry out and crack. Keep your lips moist with a moisturizing ointment such as petroleum jelly or Vaseline. Sore throats and pain when swallowing are not uncommon. This is due to the swelling of the muscles in the affected area, and the normal act of swallowing can become painful. This will typically subside in 2 or 3 days. Stiffness or trismus of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. This is normal and will resolve itself over time.